The numbers are in here in Washington. The Congressional Budget Office is out with its projection on the effects of the Senate Republican health care bill. Chief Congressional Correspondent Mike Emanuel has the latest tonight from the Capitol behind me. And Mike, good evening.
Bill, good evening to you. The Congressional Budget Office projects that over the next 10 years, 22 million people would lose coverage compared to the 23 million that would lose coverage in the House-passed bill. It also projects that deficits would be cut by $321 billion. That is more than $200 billion better than the House-passed bill. And the CBO says that after premiums go up next year, by 2020, premiums would be cut 30% compared to Obamacare. This is Republican leaders make the push to pass health care reform.
Those five are going to be responsible for socialized medicine if that's what happens, because they're the reason. They'll be the reason that we haven't been able to stop it. On the other hand, do they have some good points? Yes. There are people that we ought to listen to.
The Senate Finance Chairman turned up the pressure on his colleagues Ted Cruz, Mike Lee, Ron Johnson, Rand Paul, and Dean Heller, who say they oppose the GOP health care package in its current form. GOP leadership unveiled some adjustments to the bill today, including a lockout provision to make sure people buy insurance before they get sick. It says there would be a 6-month waiting period for people who have let their insurance coverage lapse for more than 2 months. Also today, President Trump weighed in on Twitter. The Democrats have become nothing but obstructionists. They have no policies or ideas. All they do is delay and complain. They own Obamacare. And the president suggested the Senate doesn't have to act now. Republican senators are working very hard to get there with no help from the Democrats. Not easy. Perhaps just let Obamacare crash and burn. Insurance giant Anthem came out with a statement in support of the Senate plan, saying it, quote, will markedly improve the stability of the individual market and moderate premium increases. The American Medical Association sent a letter opposing the bill, writing, quote, the AMA is particularly concerned with proposals to convert the Medicaid program into a system that limits the federal obligation to care for needy patients to a predetermined formula based on per capita caps. Meanwhile, some leading Democrats suggested passing the Senate bill would have deadly consequences.
We do know that many more people, millions, hundreds of thousands of people will die if this bill passes. 1,000 to 2,000 people will die
if you cut 750,000 people from Medicaid. So that means you're killing 1,000 to 2,000, killing them.
Republican leaders say don't believe the doomsday predictions and the time to act is now.
In all honesty, we got to get real about it, because we've got a lot of things that the federal government has to do besides health care, and if we go that route, that's the only thing the federal government's going to be basically doing.
On those coverage numbers I mentioned at the top, Republican leaders would tell you that's because people would no longer have a gun to their heads with the government telling them they must buy insurance they may not want or need, and so Republican leaders would suggest that those projections are very difficult to make.
More to come on all that analysis. Thank you, Mike Emanuel on Capitol Hill tonight.